Good morning and welcome to the Women's Public Policy Network Mother's Day press conference. Thank you to all the members of the Women's Public Policy Network who are here, the supporters of the Women's Public Policy Network that are in the room today. We really appreciate you coming together to show your concern for the women in our state and for all you do, and for bringing your families, which is really what this press conference is all about. The Ohio Women's Public Policy Network is a coalition of over 25 advocacy organizations focused on promoting policies that create economic security for women and strengthen Ohio families. Using a collective voice that represents the women of our state, this network works to ensure that public policy reflects the true need of women and families. So as we approach this wonderful Mother's Day weekend, the Women's Public Policy Network wanted to take a moment to speak out, and speak out loudly about something that would be devastating to mothers and the women that we love, and that is the American Health Care Act, also called Trump Care, that passed the U.S. House on May 4th and is now being considered in the United States Senate. This is high stakes for women and our families because the changes disproportionately impact us, and that is why we are speaking out today. The bottom line is, under Trump Care, millions of women and families will lose coverage and access to primary and preventive services. In Ohio, women and our families and our economic security is at risk. And it's not just one thing in this bill, as you will hear about today. There are multiple provisions in here, from the devastating reductions in insurance tax credits and subsidies, to cuts to Medicaid, to hikes in premium costs that would make health care unaffordable and inaccessible for millions of women and families. And making matters worse, under this House version, we, women, would essentially be treated as a pre-existing condition, because this bill treats being a woman as a chronic medical condition and a liability, because our bodies are made to become mothers. So we're celebrating Mother's Day this weekend, but on the other hand, under this bill, we're being penalized for being women and potentially mothers. So this country put a stop to insurance companies being able to deny coverage to a woman, charge them more, or price us out simply because we are pregnant. But this bill takes all of those protections away. And furthermore, treatment for physical or mental health issues caused by domestic abuse or even medical care after rape could be considered a pre-existing condition. And women could be denied coverage or charged enormous premiums. I know, your pinky fell. Thank you. So at a time when Ohio is facing one of the country's worst infant mortality rates, we can't afford the bill's devastating cuts to Medicaid and Planned Parenthood, and you'll hear more about this from our other speakers. And preventative services such as birth control, cervical cancer screenings, and annual well women visits without co-pays, deductibles, and other out-of-pocket costs, which have all improved women's health and in turn helped women achieve better economic security, those would be denied to the millions of women who would be losing coverage under this bill. You know, women have been working hard for decades to get things like birth control covered. In fact, my grandmother, who is here today, was just telling me last night when I invited her to this press conference that as a local union member, she sat at the negotiating table trying to get the insurance products that her employer was offering to cover birth control. And so here we are at a time where we have birth control covered, and they're taking that away. And that's what I think is different about this fight, is that they are taking away protections that we have in place now. And that's why we're speaking out, and that's why we are actively trying to stop and change this bill. And before I turn it over to these other women who are going to share more details about what's in this bill, I wanted to share another short story about my personal experience as a woman and a mother. And my daughter Sylvia is here today with me. Sylvia was a preemie, and she came into the world about 7 weeks early, which meant she had to spend time in the neonatal intensive care unit. And right now in our country, an insurance product is required to cover the newborn care that so many families in that situation need. So they're not sitting at the hospital trying to make decisions between bankruptcy and health care for their newborn. But again, this Trump care bill is rolling that back by sunsetting the essential benefits. So insurance companies are no longer going to have to cover things like newborn care and even maternity care. And moms deserve better, and Ohio's families deserve better. So I'm going to turn it over now to Dr. Beth Liston, who is a pediatrician, and she'll be able to share in even more detail and with a lot of experience more about how this bill will impact Ohio women and families. Dr. Liston?
So thanks for coming. Thanks for having me. My name is Beth Liston. I'm a doctor here in Columbus. I've been taking care of adults and kids who are hospitalized for a little over a decade. And of course, in honor of Mother's Day, I'm going to be talking about the healthcare legislation that just passed the House and its effects on women. And as you've heard, it's devastating for millions of people, but women are going to bear the brunt of this burden. Poverty rates are higher for women than for men. This really makes sense because women are paid a lot less for the same jobs, and we're also more likely to be responsible for childcare costs and thus have less money to spend. So when we're talking about cutting Medicaid, we're talking about harming women and families. We're talking about decreasing subsidies. We're talking about specifically women and families that are more harmed. Prior to the Affordable Care Act, a woman would frequently pay twice as much for health insurance compared to her male counterpart, even without maternity care. And as we've just heard, the bill passed allows states to remove this community rating protection, so if you don't maintain continuous coverage. What this means is that if a woman does not have insurance at all times, insurance companies can go back to charging more. And in the past, we've seen that rates have increased for things like domestic violence, sexual assault, postpartum depression, C-sections, and even pregnancy. Lots of people aren't going to be able to afford this if we use the past to judge, right, what we've seen in past experiences before the Affordable Care Act. As a doctor, I can attest that it still requires actions from a woman and a man to make a baby. But both men and women benefit from having healthy, wanted, cared-for children in our society. However, the cost of reproduction fall on the shoulders of only women. Nearly all women use some sort of family planning during their reproductive years, and there are about 2.5 million people that rely on Medicaid as a payment source for Planned Parenthood services. And there are several counties in Ohio where Planned Parenthood is the only public access for full service reproductive care. So this means things like long-term birth control, which we know is super effective. When you decrease access to adequate birth control, counseling, preventive health services, people die. We saw this in Texas in 2011, where they took away Medicaid funding for family planning services, and the result was a doubling of maternal mortality rate. We saw it in our neighbors in Indiana when they shut down Planned Parenting services. And then the result was rural areas of Indiana experienced one of the largest and most rapid HIV outbreaks due to the combination of the opioid epidemic and the lack of access to STI care and screening. This is obviously not the direction that we want for health care. As a woman, a mother, and a pediatrician, I want our kids to be healthy. Ohio has one of the highest infant mortality rates in the nation. We know that access to prenatal care and postnatal care is vital to lowering this rate. If Congress bans Planned Parenthood as a Medicaid provider, more women will lose their babies before their first birthday. I see the children that suffer from these policies in my work. I take care of newborns in the hospital who aren't growing well. We call this illness failure to thrive. These innocent babies who are too tiny are heartbreaking. The most common cause of failure to thrive is what we call non-organic, which means basically they're just not getting enough to eat. Right? This occurs in about 5 to 10% of infants in this country, and even with treatment, can have long-term health effects. Failure to thrive happens in families that are stretched too thin to be able to care for their babies. This includes moms who need to go back to work quickly after delivering, as well as the mom who's exhausted because she hadn't planned on having another child and couldn't handle it, but didn't have access to birth control. It also includes a lot of moms who are experiencing depression. In fact, more than half of infants living in poverty are being raised by mothers with some form of depression, and this puts infants' health at risk. These moms need access to healthcare and mental health services to ensure wellness, the wellnesses of their babies and our communities. The House bill puts these services at risk. Right? Prior to the expansion, when a woman was no longer pregnant, she frequently lost Medicaid eligibility. We need to make sure these families are protected. Honestly, I could keep going. I think we've touched on topics. There are others that are going to keep talking. Right? We could talk about essential health benefits, which are being phased out with the bill, which means things like cervical cancer and breast cancer screenings may not be covered. We haven't really talked about older women who need long-term care services and the effects on them, or school education, school health programs for children with disabilities, which may be phased out as well. Overall, this is a horrible bill for everyone, but especially for women. We need to do better if we want to keep moving forward to improve our healthcare system. Thank you.
Thank you, Dr. Liston. We're going to turn it over to Wendy Patton with Policy Matters Ohio to give us even more perspective. Wendy.
Thank you, Janetta. I'm Wendy Patton. I'm with Policy Matters Ohio. We're a non-profit, nonpartisan research organization with the mission of contributing to a more equitable, inclusive, and sustainable Ohio. The House Health Care Plan is a direct blow to women and would have a devastating consequence for the nearly 40 million American women across the country who rely on Medicaid. It would slash Medicaid by more than $800 billion over 10 years by eliminating the Medicaid expansion and imposing a restrictive cap or block grant structure on the entire program. Women would bear a disproportionate impact of these cuts. I'm going to talk about Medicaid first, but there's also an impact on women with private insurance through their employer. The House Health Care Plan would slash Medicaid by more than $800 billion over 10 years by eliminating the expansion and imposing a restrictive cap or block grant structure. Women are the majority of Medicaid beneficiaries in Ohio. 1.6 million women are covered by Medicaid. The majority of enrollees in the Medicaid expansion here in Ohio were men, but the expansion allowed more than 300,000 women in Ohio to get health coverage. Women live longer, so we're much more likely to get health coverage services like nursing homes and home and community-based services in our old age. We also bear children. Medicaid financed 52% of the births in Ohio in 2014. It provides prenatal care and allows coverage for new mothers who qualified while pregnant but would lose such qualification after pregnancy under the new health plan of the House. Ohio has third world levels of infant mortality in some of our neighborhoods, so the Medicaid program and the Medicaid expansion have been critical to our efforts to bring that rate of infant mortality down. Now, the House plan also includes provisions that are harmful to women with private insurance. It would allow states to opt out of the Affordable Care Act essential health benefits like hospitalization, emergency care, prescription drug coverage, laboratory services, and maternity and prenatal care. Prior to the Affordable Care Act, 62% of plans on the individual market did not include maternity services. If you wanted that, you had to pay more. And under the Ohio Health Plan, we returned to the bad old days in which women are charged more for maternity coverage depending on what state they happen to live in. The House plan would eliminate Medicaid funding for Planned Parenthood, which is a 100-year-old institution that serves millions of American women every year. 1 in 5 American women has visited a Planned Parenthood clinic. The House health plan defunds Planned Parenthood by broadly denying use of Medicaid funds to pay for any health provider that provides abortion service. This is a service that is part of women's health care. Planned Parenthood will continue providing comprehensive women's health coverage. Abortion services are a small share of the services they offer, but it's part of women's health care. In addition, under the House health care plan, women would no longer be able to use tax credits to purchase insurance for plans that even cover abortion, with exceptions for rape, incest, or life of the pregnant woman. This could make access too expensive for many individuals and in turn lead to insurance providers dropping abortion coverage altogether. The Affordable Care Act prohibited insurers from charging people more if they had pre-existing conditions. The House health plan would allow states to waive the rules prohibiting this. Question: can a previous C-section become a pre-existing condition that affects your cost of maternity care? It's a state-by-state situation under the House bill. The House bill would fundamentally change the structure of the Medicaid program, and this is one of the most damaging aspects. It would end expansion, and it would make the Medicaid program a block grant, or a type of block grant. It's called a per capita cap. This typically dwindles over time relative to need. The block grant would be pegged to 2016 costs. Ohio would be a big loser for demographic reasons. We have an aging population. We're aging rapidly. Women and their families are again right in this bullseye. In Ohio, 2/3 of our elders are women. The need for and cost of care for elderly people and disabled people is higher within the Medicaid program than for other groups. Over time, as the federal funds dwindle under a block grant, state lawmakers would scrutinize the most expensive cuts for cuts to eligibility and services. As the debate on the health care plan shifts from the House to the Senate, policymakers need to reject any health bill that causes loss of coverage, caps or cuts to the Medicaid program, that ends the Medicaid expansion and takes away critical protections. Failing to meet these standards would harm millions of women and their families throughout the nation and in Ohio.
Thank you, Wendy. Next, we're going to hear from Linda Kanney, who is a member of the Public Policy Committee of the National Coalition of 100 Black Women Central Ohio Chapter. Linda.
Thank you. Good morning. As mentioned, my name is Linda Kanney, and I stand here today representing over 8,000 members of the National Coalition of 100 Black Women Incorporated. The mission of the National Coalition of 100 Black Women is to advocate on behalf of black women and girls to address disparities in the areas of health, education, and economic empowerment. And my co-chair of the Public Policy Committee is with us today, Robin Jones. Thank you, Robin. Double duty. NCBW believes that access to quality, affordable health care is a right that everyone, regardless of race, gender, and income, should have. It's critical in the fight to eliminate health disparities for black women and girls. Some black women do not have access to affordable health care, and for those with access, they may not be able to actually afford it, because we know that access is different than being able to afford it. We are somewhat fortunate in Ohio that we have seen expansion in Medicaid eligibility to cover more low-income women. However, there are no guarantees that that will continue with this states' rights method that's being considered, particularly on the attack on the Affordable Care Act. The repeal of the Affordable Care Act will hurt millions of people who now have access. The AHCA repeal would have a devastating impact on some populations more than others, particularly people of color and seniors. These populations are already hurt by economic inequality and the revolving door of poverty, lack of access to health care, and poor health. For example, black women are diagnosed with and die from breast and cervical cancers at higher rates than white women. They are also twice as likely to have heart disease as a result of obesity, elevated cholesterol, high blood pressure, diabetes, and other chronic conditions, and experience higher incidence of infant mortality, as was mentioned previously. With the threat of the repeal of AHCA, these are pre-existing conditions subject to denial by insurance providers, and if able to be insured, would be charged higher premiums. In 2013, before many of the AHCA's key provisions kicked in, women of color were disproportionately likely to be uninsured. 22% of black women and 36% of Latino women compared to 13% of white women. Pre-ACA, women were far more likely than men to have to forego care because of cost concerns, and cost was a major barrier to care for all women. Many women had difficulties paying their medical bills and reported that a shortage of time and the unavailability of time off, in addition to child care and transportation barriers, impeded their ability to even access care. More than 2/3 of low-wage workers are women, and this group is disproportionately comprised of women of color, because low-wage jobs usually do not provide benefits such as employer-based health insurance, paid sick days, or paid leave. Women are impacted not only by the gender income gap, but also by significant race and gender wealth gaps. Since the implementation of ACA, the national uninsured rate has reached an all-time low. The uninsured rate for black women has dropped by more than 40%, and the number of black women who reported delaying or foregoing care because of cost fell almost 20%. That is at risk of being obliterated. The ACA plays a key role in eliminating racial and ethnic health disparities. By mandating the coverage of essential benefits, including no-cost preventive services, it has helped black women prevent and manage serious health conditions that disproportionately impact them. Repealing key provisions of the ACA, like the Medicaid expansion and premium subsidies, will not only leave millions of black women and their families without the life-saving health coverage they desperately need, but it may also widen the racial disparity gap that has historically decreased black women's quality of life. We must ensure any health policy put into place provides the maximum protection for women of color and their families. The National Coalition of 100 Black Women Central Ohio chapter will continue to advocate and hold national and local policymakers accountable for fair, accessible, affordable, quality health care. We are entitled to health care just as much as any elected officials are. Thank you.
Thank you, Linda. Our final speaker is Joanna Saul, and she's representing Planned Parenthood Advocates of Ohio. Joanna.
Thank you, Janetta. While I'm here to speak on behalf of Planned Parenthood Advocates of Ohio, I want to take a second to thank all of the other speakers for individually and independently also advocating for Planned Parenthood. Planned Parenthood is the single largest provider of reproductive health care and sex education in the nation. We believe that access to health care is a human right. The American Health Care Act is the worst bill for women's health in a generation. It will block people with Medicaid from accessing preventative care at Planned Parenthood health centers, including birth control, cancer screenings, and STD testing and treatment. Over 33,000 Planned Parenthood patients in Ohio would not be able to use their preferred provider because of Medicaid restrictions. While Ohio Planned Parenthood health centers comprise 19% of the state's safety net centers that offer family planning care, they serve 52% of the patients relying on these centers. In 8 Ohio counties, Planned Parenthood is the only provider of full-service birth control, and in 22% of Ohio counties, Planned Parenthood serves the majority of patients receiving publicly funded family planning. This bill disproportionately impacts women. Preventing vulnerable women, particularly women of color and low-income women, from accessing affordable reproductive health care is against the concept of making America great. Furthermore, this legislation would undermine the enormous progress that we have made in women's health care. We are at a historic low in teen pregnancies and at a 30-year low for unintended pregnancies, thanks to access to family planning. The fact that millions of women will lose coverage means they will no longer have access to no copay birth control. Under the Affordable Care Act, more than 55 million women gained access to no copay birth control. Paying out of pocket for birth control pills can cost a woman up to $600 per year, which is simply unaffordable for many young women and people with low incomes. Essentially, politicians who support this legislation have said it doesn't matter if you cannot afford birth control and cancer screenings and have nowhere else to go. We know that 65% of Ohio voters oppose blocking patients from accessing Planned Parenthood's preventative health services. We urge every voter to pick up the phone and tell their congressman that they oppose the American Health Care Act. Thank you.
Thank you for being here and listening to these extremely smart, capable women who are telling these stories. And that's what we're asking on this Mother's Day. We're asking you to hear us. We're asking you to listen to the women and the mothers in your life. Hear our concerns about this troubling bill, to stand with us. You know, many of us embrace being women and mothers, and we're just asking not to be punished for it. So thank you for being here today, and we will open